Hey, I just got off the phone with a mother, and it's a pretty typical phone consultation for us. So I thought I would share it in case you know people who are going through this kind of thing. So she has I think, 9-year-old daughter and a 7-year-old son, and they're both really bright and really creative. The little boy has a lot of emotional meltdowns. He doesn't like to lose at all, and he really, his meltdowns are out of proportion. He gets into a rage, and you cannot reason with him. But that's what happens when we get into a rage. Our frontal lobe loses blood and oxygen, and we just can't think straight. And we get all up on our animal brain and kind of act like animals. So that's not uncommon for rage. But the question is, why are more and more young kids having rage? Well, there are a lot of factors influencing this. One of the things is that we are in a hormone crisis. We have so many estrogens in our environment. It's bringing down testosterone in men, creating a lot of problems, cancers, but also that's a lot of stress on the brain for the hormones to be so whacked out. And that's due to foods and plastics and toxins and people spraying their lawns with poison, just so many things going on. Anyway, so what can we do about that? So we map the brain with a quantitative EEG. This is a non-invasive, safe, simple process for us. And we're able to see each individual's brain and how it's functioning. This is a functional neuroimage, not a structural. So we're seeing how the brain is actually functioning. And so a lot of kiddos that represent or present with, that kind of trouble with mood regulation, it's fascinating because a lot of their brains have very, very slow delta and theta waves. So they're kind of having a metabolic crisis in their brain. They've got a slow, sleepy brain that's underpowered oftentimes. And then in addition to that, in the limbic part of the brain, they have high beta. So they're anxious and their brain is not functioning well. It's lacking power and it's lacking the ability to focus well. So when a kid like that encounters a situation that's difficult for them, they don't have the energy that's required to deal with it properly, so they just melt down. So what we do then is we use a combination of neurofeedback, 19-channel EEG neurofeedback, and neurostimulation. So this is things like transcranial direct or alternating current, pulsed electromagnetic therapy, light therapy, and sound therapy. And it's all directed by a quantitative EEG. So we are not guessing. We are looking at what that brain is needing and giving it to it in a safe and non-invasive way. And kids enjoy the treatment. For the feedback, they get to watch a movie, any movie that they want. So we've been doing this. My husband has been doing this almost 35 years, and we have amazing results. We've seen many young people come to us diagnosed with ADHD, dyslexia, processing disorders, and literally they have lost their diagnosis after doing neurotherapy with us. So there is something that we can do besides drugging these kids. Drugging kids is not the answer. I understand that there are times when temporary medication may be useful, but it should never, ever be a long-term solution because it's not a solution. It doesn't actually fix anything at the root. It just covers over symptoms and creates a whole host of other problems while it's doing that. So anyway, if you are interested in finding out more about our neurotherapy, I would love to have a chat with you. I do free phone consultations. We treat a lot of kiddos with a lot of mood and focus and learning issues, but we also treat a lot of adults with anxiety and depression, ADHD in adults too, autism, stroke recovery, seizure disorders, traumatic brain injury. But you don't have to be sick to get better. So we've also treated people who want to perform more optimally than they are. So if you're interested, give us a call, 901-624-0100, or hop on our website, neurosource.net. Take care.